What if I told you that some of America's top physicians, people trained at Harvard, Johns Hopkins, and the Mayo Clinic, are quietly sending their children 8,000 miles across the Pacific? Not to London, Tokyo, or Sydney, but to a place many Americans still overlook: the Philippines. Yes, the same country known more for tropical beaches, jeepneys, and karaoke-loving culture than for its medical schools. At first, it doesn't make sense. Why would well-off American doctors, who could afford any school in the world, choose to send their children to what some would call a developing nation? The answer is more surprising than you think. A quiet transformation is happening here, and it begins with a man named Dr. Stephen Miller, a trauma surgeon from Minnesota. For years, prestige meant everything to him: titles, board certifications, endless pressure. But when his only son, Noah, struggled in the traditional U.S. pre-med track, Doctor, Miller realized something. The system wasn't built to nurture students like his son. It was built to weed them out. One cold night, after another of Noah's panic attacks, Doctor Miller searched the unthinkable: affordable international med schools with good clinical experience. Among the results was St. Luke's College of Medicine in Quezon City, Philippines. At first, he scoffed, but curiosity got the better of him, and what he discovered surprised him: lower tuition, American accredited curriculum, professors who knew students by name, clinical exposure starting in the first year, and a culture rooted not only in knowledge, but in empathy. 2 weeks later, father and son boarded a flight to Manila. What they found wasn't a downgrade. It was a different kind of education, one that valued humanity as much as anatomy. Noah's first anatomy lab began with prayer. His first rural rotation put him face to face with scarcity, forcing him to learn resilience and compassion in ways no textbook could teach. He delivered babies in rooms without air conditioning, treated patients with limited supplies, and discovered what it really meant to be a healer. Back home, his father watched his son transform, not into just a doctor, but into someone who truly saw people. Nurses noticed it. Patients noticed it. And slowly, other American families began to notice too. They started following the same path, sending their children to the Philippines. Soon, what began as one father's desperate search became a quiet movement. Parents weren't just asking, which school has the highest test scores? They were asking, where will my child become the kind of doctor patients remember? And the answer, again and again, was the Philippines. Graduation came. It wasn't flashy. No orchestras, no celebrity speakers. Just pride, tears, and a simple truth. This wasn't a step down. It was a step forward. Noah later matched with a U.S. residency, and his patients quickly noticed something different about him. He didn't just treat symptoms. He connected, he listened, he cared. And his story wasn't unique. Dozens, then hundreds, of American families made the same choice. Philippine medical schools, once considered backup options, became beacons of training where grit, compassion, and humanity were just as important as credentials. The Philippines, so often underestimated, stood tall, showing the world that the best doctors aren't always trained in the wealthiest countries, but in the most human ones. Because here, medicine is still a calling, healing is still sacred, and love still belongs in the room. So maybe the real question isn't whether Americans should send their children to study in the Philippines. It's whether the world is ready to listen to what the Philippines has been teaching all along: